Flu is a serious viral illness. It has symptoms of cough, sore throat and absolutely severe malaise. It can make you feel like you've been hit by a bus. Staff in care homes are looking after very vulnerable residents who, because they tend to be elderly, may have a lowered immune system. That makes them more vulnerable to picking up any infection. Combined with that, you're bringing people together in a group setting, which means that infections maybe can pass easily between residents and between the staff. And of course then potentially staff could take things back to their own families. And it's quite easy to see why a care home could be a centre for an infection like flu to really flourish. There was an outbreak of flu here in Eartham in Sutton last year. It was a very severe infection. There were several patients that required hospitalisation because of their illness.
When we had the flu, it was devastating because you get so attached to everybody. It was like your grandmother being ill and you take it personally, really. It all started on a Tuesday morning. One of our residents became unwell with a sore throat and a high temperature. So we called the doctor out and we were just told it was a virus. Then by the afternoon, we had to declare a flu outbreak with Public Health England. By Friday, we had over half of the residents unwell and a quarter of the staff were off sick or were being sent home unwell. So it was a really stressful time. I contacted Public Health England to let them know, and then they told me steps that I had to follow to isolate people and make sure we had protective clothing. We shut down the home so that we had no visitors. We couldn't take admissions. We couldn't have any social events. And this went on for nearly 2.5 weeks. And I never knew flu was that bad. Every day there was new people unwell. And then it was about 3 or 4 days after the outbreak and the staff started going down unwell. And they had similar symptoms, sore throat, high temperature. When staff were off, they had to remain off until they were symptom-free, or there was a risk that they could bring it back into the home and spread it through to other residents in the home or other staff members. And we were very lucky, we got a very good GP, and she came every day and did like a ward round with myself, and we went to see everybody to see if they were getting better. But we were fully aware that that put a lot of pressure on the surgery, that she had to leave after doing her surgery to come to us. Also, the local A&E had to take 4 of our residents into hospital for admission.
Public Health England contacted me from the outset when they suspected that there was an outbreak of influenza-like illness here at the Eartham Care Home. And so, with my 2 hats working for the public health side, for the authority, but also from the NHS, from the clinical commissioning group, we started to bring in all the key stakeholders such as the GPs, community pharmacists, the NHS local trust and the A&E department, the microbiologist who would be getting all the samples and identifying what type of flu it was. The most important thing, I think, was that everybody was communicating so well and having regular updates, so we all knew exactly where we were in this outbreak. That was key in bringing the outbreak to an early close.
Flu vaccination is free for all social care staff now across London, so there should be no barrier for anyone who wants the flu vaccination to actually have it. There are some real myths about flu vaccine, and one of them is that you have the flu vaccine and you get the flu, and that is nonsense. It does not cause flu. It's a dead, inactivated vaccine. It cannot cause the flu, but because it's setting up a response in your body, you may have a couple of aches and pains for a day or so, but that's a good thing because it means that your body's responding to the vaccine and it means that you're not going to get flu.
I thought, oh, I have a bit of a headache, so I thought I'd carry on the shift, went home. The next day, bang, I thought, oh my God, I've been hit like a bus. I took off 6 days. It was quite big because it wasn't only me, there was a member of staff that got ill, and it was a big impact on my life because I didn't get paid for it, I don't get sick pay, I didn't want to give it to my daughter and my partner, and it was just terrible. I was advised to get the flu vaccine. I was like, well, I don't really get ill, so I thought I don't need it, and that's why I didn't have it done. But now looking back, I wish I did get it done, and next time I will get it done.
If staff get flu, they're likely to be off for anywhere between a week, 2 weeks, and that obviously causes disruption to the running of the home. For the residents, it's a challenge, especially for some of the elderly with things like dementia, for example. They like things to be stable, so having different faces coming in, people that don't know their routines, that can be very unsettling.
Our staff are now very keen on having the vaccine now. After witnessing what we all went through, we've already made an appointment with our chemist to book the vaccine, and we're going to be one of the first homes to have all our vaccines done this year. If there's anything we could do to prevent flu, we should try. So I urge all managers and care staff that to think of the residents and to think of their own families, because it's not just the residents, it spreads out to the community. That if we just do one small vaccine might make a big difference.